Hello, everyone, and welcome to the P for Prevention podcast, where we aim to promote, publicize, and popularize prevention. Starting off our first episode here is a research on telehealth interventions for the secondary prevention of coronary heart disease, a systematic review and meta-analysis. What a title. I have a feeling I might be saying that a lot. Perhaps it will become a slogan? Continuing on, this paper was published in April of 2019 and focuses on cardiac rehabilitation and is an evidence-based secondary prevention program for CHD, aka coronary heart disease. So we have a tiered relationship here. This paper proposes telehealth helps attendance for cardiac rehabilitation, and cardiac rehabilitation helps coronary heart disease. The major premise of the paper is that telehealth could be a substitute or just supplementary for cardiac rehabilitation and even usual care for patients with coronary heart disease. Spelling bee time. This paper uses the word adjunct, a synonym for supplementary. It is spelled ADJUNCT, and it can be used one of two ways. The first is a non-essential part added to something else. In this case, the paper used adjunct care, which would be its adjective form, most likely meaning added to care in an auxiliary way. This is also seen in the title adjunct professors, who are part-time professors. As a spoiler, telehealth was found to be significantly associated with lower rehospitalization or cardiac events when compared to non-intervention groups. However, there was not any significant association found with lowering all-cause mortality in comparison with other cardiac rehabilitation itself and/or usual care. Based on this paper, there is no need to fear not utilizing telehealth as a resource, as long as you have a form of cardiac rehabilitation and/or usual care. I'm not a medical professional, so please make sure to consult your doctor regarding this. Oh, and it's spelling bee time once again. This time we will look at the phrase weighted mean difference, or WMD. It's the difference between effect estimates for intervention and control on a specific scale, and this is a direct quote from stats.stackexchange.com. For a more detailed explanation, I found htaglossary.net, where they explain that in a meta-analysis, when study results measured using the same scale are being combined, the difference between two means weighted by the precision of the study. And finally, in meta-analysis, Statistics for Biology and Health, their abstract states, mean difference can be used as an effect size measure if the outcome variable has the same unit of measurement for both the treatment/intervention and placebo/control groups. The raw mean difference can be scaled by the inverse variance weight to define weighted mean difference. Unlike the SMD, the WMD retains the same unit of measurement as the outcome variable. Phew, that was a little more lengthy than anticipated. Thanks for sticking with me through it. Just as a reminder, we will be switching back to the conclusion of the telehealth interventions paper. Essentially, it finishes that telehealth could be another option for patients who cannot attend cardiac rehabilitation, or, and we have a callback here, as an adjunct to cardiac rehabilitation for effective secondary prevention. In addition, this paper was not funded by any specific grant and has no conflicts of interest. They acknowledge that telehealth was found to significantly improve cardiovascular risk factors. Although it was not found significant, with telehealth interventions, fewer deaths occurred over time. Finally, telehealth could help those who need it access formal cardiovascular secondary prevention and help close the current evidence practice gap. If you are interested in more papers like this, there was a paper published in 2009 with a similar title, Telehealth Interventions for the Secondary Prevention of Coronary Heart Disease, a systematic review. Essentially, the one we discussed in detail was a meta-analysis. The one published in 2009 is a systematic review. In the discussion section of the newer paper, they do mention this is an updated systematic review, which references the previous paper. And that's it. Thank you for listening. If you have any tidbits to add, diseases to suggest, or constructive criticism, please comment down below, especially constructive criticism. While I am summarizing published papers, I do hope to provide people with the most reliable information I can. See you all next week.